Contraceptive pills may increase the risk of injuries in women, according to research conducted by sports scientists at the University of Copenhagen. The study found that synthetic estradiol, which is a key ingredient in many contraceptive pills, prevents muscle attachments from strengthening during physical training. This research builds on previous observations that female athletes are more prone to tendon injuries compared to their male counterparts. When men engage in running exercises, their tendons typically thicken. However, young women do not experience the same tendon growth when performing similar activities. Animal studies have shown that the female sex hormone estradiol reduces the growth of tendon tissue. The Copenhagen study involved 24 women with an average age of 25 who regularly exercised 4 to 5 hours per week. Half of the participants had been using contraceptive pills for 7 years, while the other half had never used them. The women performed leg extension and kicking exercises in a laboratory setting. The day after the exercise session, researchers collected tissue samples from the exercised muscle attachments. They measured the concentration of PINP, a molecule that indicates new tissue production. Women taking contraceptive pills showed lower levels of PINP, suggesting reduced tissue growth in response to exercise. The researchers also examined levels of IGF-1, a hormone that stimulates muscle attachment growth. Blood tests revealed decreased IGF-1 concentrations in women using contraceptive pills. This reduction was even more pronounced in the muscle attachment tissue samples. Further investigation revealed that contraceptive pill use increased the production of IGF-1, a protein that neutralizes IGF-1, while the pills also increased levels of IGF-3, which enhances IGF-1 function. The increase in IGF-1 was more significant, potentially explaining the overall reduction in IGF-1 activity. These findings suggest that women using contraceptive pills may face an increased risk of developing exercise-related injuries due to reduced tissue growth and repair. However, the researchers emphasize the need for additional studies to confirm these results and explore their implications fully. Women who use contraceptive pills and engage in regular physical activity should be aware of this potential increased injury risk. It may be beneficial to incorporate additional injury prevention strategies such as targeted strength training, proper warm-up routines, and gradual increases in exercise intensity. Athletes and fitness enthusiasts using contraceptive pills should pay close attention to any signs of overuse or strain in their muscles and tendons. If persistent pain or discomfort occurs, it's important to consult with a healthcare provider or sports medicine specialist for personalized advice and treatment. This research highlights the complex interactions between hormonal contraceptives and the body's response to physical activity. It underscores the importance of considering individual factors when developing exercise programs and injury prevention strategies for women.